Today marks the end of California's COVID-19 state of emergency. News Channel 3's Jennifer Franco explains what the change means for the daily lives of residents here in the Coachella Valley.
Nearly 3 years after declaring a state of emergency over COVID-19, Governor Newsom's response to the virus is entering a new phase. So what changes should you expect? Not a whole lot if you ask Dr. Alan Williamson at Eisenhower Health.
It's more symbolic than I think really having a great, tremendous impact on any individual or any hospital at this point.
He says at this point, COVID-19 is part of everyday life as we're now in the endemic stage. The end of the state public health emergency doesn't mean the end of the virus.
We still see anywhere from 10 to 15 patients a day on average in the hospital that have COVID-19.
So it's important to take steps to keep yourself healthy, says Dr. Gemma Kim with Desert Care Network.
That's why prevention is even more key, because the treatment options, the testing, supplies, all of that may not be free anymore.
She says prevention means masking, hand washing, and avoiding people who are sick. Even with the state's public health emergency coming to an end, it does not expire at the federal level until May 11th. Right now, whether you're insured or uninsured, it's pretty easy to get free COVID testing, treatments, and vaccinations. That may change in a few months, depending on your insurance policy. Medicaid will continue to cover all COVID-19 vaccinations and treatments without a copay or cost sharing through September 30th, 2024.
There are some things theoretically that have changed. There were some relief from various regulatory requirements regarding the use of space.
Dr. Williamson says Eisenhower Health hasn't needed to modify the use of space in at least the past year. When the federal health emergency ends in a couple months, there will be changes to coverage for COVID testing and to reporting of COVID-19 lab results and immunization data to the CDC. Dr. Gemma Kim says as a nation, we're much better prepared to handle any changes.
The virus will constantly keep evolving, and in order to keep up with that, we're just going to have to keep working on the vaccinations and updating them.
In Palm Springs, Jennifer Franco, News Channel 3.